Coming up in today's video, guys, we've got 2 deep wax removals and a very full ear canal from Taylor Green. My name is Rhys. I'm one of the audiologists here at Audiology Associates.
And I'm Taylor Green.
So this is Katie's patient, and this gave you a bit of a backstory of this patient. We've got some very, very deep-seated skin packed down into the anterior recess. You'll notice the ear canal looks really red and irritated, and that's because this patient has actually been on antibiotics for the last week. So for an outer ear infection, which is exactly what we're seeing the remnants of here. So Katie's doing a fab job pulling all this dead skin. You can see how floppy that is. Dead skin from deeper in the canal, but a very irritated canal and irritated looking eardrum there as well.
Yeah, just kind of going up and around that eardrum, very kind of like mottled, cloudy sort of, bit of a sore looking ear.
That is, and that will settle over time. So it will get a little bit more kind of settled over the next couple of days. Because I think they've still got a few more antibiotics left to have. This is yours. Yeah,
and this is my patient. Yeah, so this is actually a regular patient who attends, I think, every year. Okay. Quite small ear canals, but you can also see we've got quite a lot of hair in there as well. So the vision is not the best on this one, because this is like, I've put this in here just so you can kind of see what we have to deal with sometimes in some ear canals. But yeah, it's kind of a dry sort of consistency. You know, the patient's not really having any issues with the hearing at this point. The reason for the appointment was the patient was going on a flight. They're going abroad. And just wanted to get them checked and cleared if anything was there. So, so that was a good job we did book in, I say, because, you know, chances are you'll probably jump into the pool and
that's lucky. It's very hairy in there, isn't it?
Yeah, and like I said, the small ear canal doesn't help either, because all those hairs are starting to sort of, what's the word?
Embed.
Yeah. So yeah, we got the standard size tube here now. I'm just trying to lift and peel this block away. I'm kind of listening for the suction at this point, because I'm trying different parts of this plug to get that good grip. And I have got a good grip, but I think this is going to get stuck.
It looks like it's going to wedge, because sometimes you'll bring it forwards, and I almost try and wedge it in the outer portion of the ear canal, so that when the tool goes in, the manual tool to scoop it out, you can just kind of drop the top a little bit and get behind it then.
Yeah.
But you've got that bit of dry skin that's complicating things there, haven't you?
Yeah, it does almost look like it is moving though. So every little wiggle you can see, it's all coming out now. So because it's quite dry, I'm trying to aim for that little sort of
knobbly bit.
Yeah,
like kind of front end, the nose of the wax.
Yeah, because I'm struggling to get a grip at this point. Now, I know I probably could have gone in with like a manual tool to sort of scoop it out, but I thought, you know, I've got it this far, you know, it should come out with a suction technically. But
well, yeah, if you can get a good enough grip, if you can do it mil by mil, it'll work its way out.
Yeah.
And it depends on the gap as well, because you know how firmly wedged that is in the canal. If you think about putting a tool in, it's going to push it further back.
Yeah, there we are. We swap over now, so there's a little tiny gap there. I'm going to just try and bring this down a little bit, just to almost create a little gap there.
Well, that's sheer then, or is that the whole thing?
I think that might have been the whole thing. I honestly thought it was going to be more. I might be wrong. The way that was like moving, I thought that was going to be a much longer plug.
Oh no, there you go.
No, yeah.
Look at that.
Little tiny spot left there. Oh, got a bit of oil on the camera. Oh, gosh. There we go.
Look at that.
So yeah, but it's a bit of an awkward one, because again, it's always, obviously it's the same every time the patient comes in. You know, there's nothing we can do about the hair. You know, we get a lot of people saying, "Oh, I trim the hair." I mean, you need the hair in there. It does sort of serve a purpose.
Yeah.
It's a form of defense actually for your ears. It's going to stop things like dust and debris, you know, from getting inside your ears, you know, as well as the wax trying to fight off infection as well. It's, you know, it's quite a complicated little area, the ear canal. There we go. It's
it's a slightly tougher type of wax, isn't it? So it's not always the best to get a good suction grip on. And in this case, those hairs kind of complicate things a little bit, because you're gripping the hairs, and the wax and the hairs are still attached to the canal wall.
So you've almost stopped before.
Yeah.
Yeah, we've got the forceps here now. I can see there's a little bit of a gap either side, so I'm going to try... Oh, just pushed it in a little bit further there. This is the risk we have when, you know, these dry plugs are quite loose. And there we are, we've got a good grip.
Nice.
Kind of surprised myself on that one.
I know, that's a good one.
I was like, oh, am I going to get this? But yeah, nice and clear otherwise.
Okay, very well. So, just over an inch.
Yeah, so about 3 centimetres, including that little tail on the end.
It's back to me again now. So this is a paediatric patient here, and they were having some difficulty with their hearing. They felt everything was a little bit muzzy, and it's very similar in both sides. So what we've got here is almost like an anterior recess removal. And this wax, when I got it out eventually, it felt like little bits of stone. It was so hard and been there for so long.
Oh gosh, wow.
Look at that. You know, on first glance, that doesn't actually look like a lot of wax.
No.
And you know, on the paper at the end, it looks quite pathetic, to be honest. But you know, when it's in there and it's right next door to the eardrum.
Oh, it makes a difference.
Yeah, yeah.
I've cleared less away, and the patient has mentioned, you know, there'd been a big increase.
Oh yeah.
In sound quality and how it feels.
Yeah.
Yeah.
But it's coming away. But don't forget, this is also a paediatric patient as well. So she did absolutely brilliantly.
Oh, fair play.
There we go. And then we've got very similar, a little bit worse on this side. So this was actually the worst of the two ears. And there's a little bit of dry skin as well right at the entrance. So I'm looking here, if we can pull, I was hoping that was going to be attached to the rest and we'd pull it and the whole thing would come out.
Yeah.
Because I do like if they kind of pull from the recess, really.
Oh, yeah, that's going to bring it all.
Yeah.
Yeah, there you go. Oh.
It just snapped. I was actually saying that to the child as well. I said, oh, look, it's kind of on its way. I'm going to take it really slowly, see if we can get the whole thing out. But it just didn't want to come.
It's like almost like eczema or something.
Yeah, it does, doesn't
dry,
it?
like cracked.
I did say you to go along to your local pharmacist. They'll give you some cream or something you can put on the outside edge just to calm that down. I did say to use some olive oil as well.
Oh, look at that tiny little.
There's a really tiny bit. So I've had to put a bend now on the fine end just to drop the angle because the reason being is obviously it was stood up right like this. You're going at an angle like that, you can't get the suction grip because it's sort of tilted back. So if you put a slight bend, you can kind of drop up and over into that gap. I'm taking it really slowly here. I don't want to touch the eardrum at all. You can see I'm kind of hovering. There we go. We got the grip.
Yeah, I haven't put a bend on a tube in a while. I had to do it yesterday as well.
Do? Yeah. We do it quite often. It's just to kind of just get that little bit of a bend to get the angle you need. 3/4, just under 3/4 of an inch.
Just over a centimetre and a half.
Well, guys, thank you very much for watching our videos today, and I hope you enjoyed it as much as me and Taylor did voicing over. If you do enjoy the videos, don't forget to like, heart, share, follow, and subscribe for us. And if you really enjoy the videos, you can become members of the channel. You will get extra videos, 104 extra videos a year. There you go. And you will also get early access to every single video we put up, because as soon as I've edited it and put it up online, members can see it straight away, and then subscribers don't see it after. So you will get early access to every single video. But until next time, guys, as always, take care of yourselves.
Take care of your ears.
Take care of one another. Myself and lovely Miss Taylor Green. We'll see you again soon. Bye, everybody.
Bye-bye.